Are you or a loved one living with chronic obstructive pulmonary disease, COPD? If so, you know firsthand the challenges of managing symptoms like shortness of breath and wheezing. That's where Umeclidinium comes in, a breakthrough medication that can help you breathe easier on your journey to COPD relief. Understanding COPD and its impact on breathing. COPD is a chronic lung disease that affects millions of people worldwide. It is characterized by inflammation and narrowing of the airways, making it difficult to breathe. The most common symptoms of COPD include shortness of breath, wheezing, coughing, and chest tightness. These symptoms can significantly impact a person's quality of life, making even simple tasks like walking or climbing stairs a challenge. The main cause of COPD is long-term exposure to irritants, such as cigarette smoke, air pollution, and chemical fumes. Over time, this exposure leads to damage and inflammation in the lungs, resulting in the development of COPD. While there is no cure for COPD, there are treatments available to manage symptoms and improve lung function. Introducing Umeclidinium. What is it and how does it work? Umeclidinium is a bronchodilator that belongs to a class of medications called anticholinergics. It works by relaxing the muscles in the airways, allowing them to open up and improve airflow. By reducing the constriction of the airways, Umeclidinium helps to alleviate the symptoms of COPD, making it easier to breathe. One of the key advantages of Umeclidinium is its long-lasting effects. Unlike some other bronchodilators that require frequent dosing throughout the day, Umeclidinium only needs to be taken once or twice a day. This makes it a convenient option for those with a busy schedule, allowing them to maintain symptom control without the hassle of frequent medication administration. The benefits of Umeclidinium for COPD patients. Umeclidinium offers several benefits for individuals with COPD. Firstly, it helps to improve lung function by opening up the airways and allowing for better airflow. This can result in reduced shortness of breath, wheezing, and coughing, making it easier to perform daily activities and exercise. Additionally, Umeclidinium has been shown to reduce the frequency and severity of COPD exacerbations. These exacerbations, also known as flare-ups, are episodes where COPD symptoms worsen and can lead to hospitalizations. By using Umeclidinium regularly, COPD patients can potentially decrease the risk of exacerbations and enjoy a more stable respiratory condition. Furthermore, Umeclidinium has been proven to be safe and effective for long-term use. Clinical trials have demonstrated its ability to provide consistent symptom relief over an extended period. This makes it a suitable option for individuals who require ongoing management of their COPD symptoms. How to use Umeclidinium for maximum effectiveness. To ensure maximum effectiveness, it is essential to use Umeclidinium as prescribed by your healthcare provider. The usual recommended dose is 1 inhalation once or twice daily, depending on your specific needs. It is crucial to follow the instructions provided with the medication and to consult your healthcare provider if you have any questions or concerns. Before using Umeclidinium, make sure to read the patient information leaflet that comes with the medication. This leaflet contains important instructions on how to use the inhaler device properly. It is essential to understand the correct technique for inhaling the medication to ensure that it reaches your lungs effectively. Remember to clean your inhaler device regularly and replace it as instructed by your healthcare provider or the manufacturer. This helps to maintain the effectiveness of the medication and reduce the risk of contamination or malfunction. Potential side effects and precautions of Umeclidinium. Like any medication, Umeclidinium may cause side effects in some individuals. The most common side effects reported include dry mouth, throat irritation, cough, and headache. These side effects are usually mild and temporary, but if they persist or worsen, it is important to notify your healthcare provider. In rare cases, Umeclidinium may cause more severe side effects, such as allergic reactions or difficulty breathing. If you experience symptoms such as rash, itching, swelling, or difficulty swallowing or breathing, seek immediate medical attention. It is important to inform your healthcare provider about any other medications you are taking, as certain drug interactions can occur with Umeclidinium. Additionally, if you have any underlying medical conditions, such as glaucoma or urinary retention, it is important to discuss these with your healthcare provider before starting Umeclidinium. Comparing Umeclidinium to other COPD medications. There are several other medications available for the management of COPD, including other bronchodilators and inhaled corticosteroids. Each medication has its own unique characteristics and may be more suitable for certain individuals based on their specific needs and preferences. Compared to other bronchodilators, Umeclidinium offers the advantage of once or twice daily dosing, providing convenience and ease of use. This can be particularly beneficial for individuals who have difficulty adhering to complex medication regimens or who have a busy lifestyle. Inhaled corticosteroids, on the other hand, are often used in combination with bronchodilators for individuals with more severe COPD. These medications help to reduce airway inflammation and can be effective in managing symptoms and preventing exacerbations. Your healthcare provider will determine the most appropriate treatment plan for you based on the severity of your COPD and your individual needs. Research and studies supporting the use of Umeclidinium. The use of Umeclidinium in the management of COPD is supported by extensive research and clinical studies. These studies have demonstrated its effectiveness in improving lung function, reducing symptoms, and decreasing the frequency of exacerbations. In one study published in the New England Journal of Medicine, Umeclidinium was shown to significantly improve lung function and reduce exacerbation rates compared to a placebo. The study involved a large population of COPD patients and provided robust evidence of the benefits of Umeclidinium in improving respiratory outcomes. Other studies have also shown the long-term safety and tolerability of Umeclidinium. These studies followed patients over an extended period and found no significant adverse effects associated with the use of Umeclidinium. Umeclidinium availability and prescription requirements. Umeclidinium is available by prescription only and can be obtained from your healthcare provider or a pharmacy. Before prescribing Umeclidinium, your healthcare provider will assess your medical history, perform a physical examination, and evaluate your lung function to determine the most appropriate treatment plan for you. It is important to use Umeclidinium exactly as prescribed and to follow up with your healthcare provider regularly to monitor your response to the medication. Your healthcare provider may adjust the dosage or recommend additional treatments based on your individual needs in response to therapy. Success stories. Real-life experiences of COPD patients using Umeclidinium. Many individuals with COPD have experienced significant improvement in their symptoms and quality of life with the use of Umeclidinium. These success stories highlight the transformative impact that Umeclidinium can have on the lives of COPD patients. For example, John, a longtime COPD sufferer, struggled with daily activities due to his severe shortness of breath. After starting Umeclidinium, he noticed a significant reduction in his symptoms, allowing him to walk longer distances and enjoy hobbies that were once challenging. John credits Umeclidinium for giving him a new lease on life and enabling him to live more independently. Similarly, Sarah, who had frequent COPD exacerbations, found that Umeclidinium helped her maintain better control of her symptoms and reduce the number of flare-ups she experienced. This allowed her to enjoy more stability in her respiratory health and prevented hospitalizations that were previously common. These success stories demonstrate the positive impact that Umeclidinium can have on the lives of COPD patients, providing them with relief from symptoms and the ability to live more fulfilling and active lives. Conclusion: embracing a better quality of life with Umeclidinium for COPD relief. Living with COPD can be challenging, but with the help of medications like Umeclidinium, individuals can find relief and regain control over their respiratory health. Umeclidinium's ability to improve lung function, reduce symptoms, and prevent exacerbations makes it a valuable tool in the management of COPD. If you or a loved one is struggling with COPD symptoms, don't hesitate to discuss Umeclidinium with your healthcare provider. Together, you can develop a personalized treatment plan that addresses your specific needs and helps you breathe easier on your journey to COPD relief. With Umeclidinium, a better quality of life is within reach.